Perfect for my family's lifestyle. The Tile Store has what it takes to transform a house into your dream home.
The Tile Store.
Okay, raise your hand if you or someone you know has been sick lately. Are you going to raise your hand?
Oh, yeah.
You better raise your hand.
Oh, yeah.
Dr. Stephen Miller is here with the Hamilton County Health Department. It seems like you can't be on the phone with somebody these days or go to work these days where someone's not complaining about not feeling good.
Every person you talk to will tell you that their kid has already missed days of school because of that.
It's not just kids though, is it? I know a lot of adults who've been battling and they'll just say, I've got that crud, but often it seems to be a respiratory thing that's going around.
Sure. Yeah, you'll hear that a lot of jobs and workplaces are taking a hit, losing a third of their staff for several days a week due to what's going around. You hear things like walking pneumonia touted.
Yes.
Of course, you always hear the ever-present flu and even a rise in things like COVID as well.
Okay, so let's kind of break it down, can we? And I want you to be totally honest, not that you wouldn't be, but the diagnosis you have is going to dictate the treatment you get.
It will,
Right.
and you know, and many times that's hard to do in the office per se. You kind of have to talk to them, get a history, find out what's going around with their work, what's their age, what's their exposure, what's their immune status, and that kind of tailors whether or not you're going to use, say, an antibiotic versus an antiviral versus just here's some Tylenol and take some time off from work.
Okay, so the flu is kind of an obvious one. We'll circle back to that one in a second, but I want to start with this respiratory stuff.
Sure.
Because especially if you're somebody who has a breathing problem or you're elderly, that can be really challenging. So do you recommend pneumonia vaccines for people?
I certainly do, and I definitely recommend the flu shots and any shots that are tailored to someone that is dealing with something. If you have a history of congestive heart failure, the flu can put you in the hospital. If you have a history of COPD or bad asthma, you need to be getting your immunizations because you can develop bacterial pneumonia from a bad case of something like the flu.
If you get like the flu shot, you get annually because
Sure.
it's to combat a virus, right? And that virus can change and morph season to season. The pneumonia vaccine, is it a one and done?
Well, it can provide protection for a very long time, depending on which formulation. It's going to at least give you 5 years of protection. So
Okay.
being the recommendation now around age 55 of getting it, then that's going to give you at least 5 to 7 years of protection. If you have other special cases such as diabetes or maybe a history of cancer, then you may end up getting it when you're 50. So it depends.
Are you seeing a lot of RSV?
We certainly are. We're hearing that unfortunately our hospitals, our PICUs and stuff are starting again to fill up with that.
Is that always pediatric or can adults get that?
Adults can get it too, and this is kind of something we've put to the side and disregarded, and we're starting to realize that this is a major pathogen and becoming a major reason why we see a lot of our older folks ending up in the hospital. So that's why we're also recommending the RSV for the people that are in that population.
So we were talking, a group of us the other day, about the COVID years and how kind of really looking back on it, how scary it was to get together. Most of us did, but it was frightening. I guess you don't want to let things get too lax. Hand washing is still very important.
Very important. Still need to be mindful, even though the coronavirus is not nearly as bad and virulent as it was before. You need to put that also in the same category as RSV and everything else. And if you're going to someone's house that is an older adult or is dealing with some chronic illness or sickness, perhaps they need a mask or you need a mask or just some social distance. Or if anyone in your family that's going in the car with you is acutely sick, maybe you need to wait till after the holidays before you visit them.
And maybe, is that a good idea too? Don't carpool too much? Like don't cram too many friends and their kids in your backseat of your car?
Certainly if anyone is sniffling or showing any signs of illness.
What about fever? Is the rule of thumb that if you get a fever, you should begin taking medicine immediately, or is that kind of your body's way of flushing it out?
And that's the controversy there, is that if it's a low-grade fever, if we're talking about something under, say 101, a lot of times that is your body's way of raising the temperature to a point that will help eliminate viruses or other pathogens out of your bloodstream quicker. But it becomes a point where it can be dangerous. Smaller children, it could cause febrile seizures. And it's very uncomfortable because usually it's accompanied by body aches and things like that. So that's when we start to reach for a Tylenol, for a Motrin, and things like that.
So they are your resource for all types of things. They can give you the vaccines, is that right?
Yes, we can.
They can give you a lot of counseling,
Sure.
And you don't have to make an appointment always.
No, never.
And you don't just have to go to their downtown location. You have how many offices?
We have we have our Ooltewah, we have our Sequoia, as well as our Birchwood office. So please feel free to stop by.
Well, I'm not afraid. I'm going to shake your hand anyway. I've washed mine. It's the Hamilton County Health Department. Here's where you can find them online, health.hamiltontn.org. And there's their phone number, East 3rd Street, still that main office downtown by Erlanger. Great to see you.
Thank you.
A simple step can lead to unexpected consequences. Navigating the aftermath of a slip or fall isn't straightforward. If you've been injured on someone else's property, contact Weathermark Keith. It's more to us. It's personal.
Tucked away just off Shallowford Road, you'll find Creekside at Shallowford. This hidden gem is the independent living you've been seeking.